So next one is HMG-CoA reductase inhibitors. Let's see what is it. So this is the class of the drug known to be most efficient and best tolerated among all other anti-hyperlipidemic drugs. So when we compare other anti-hyperlipidemic drugs, it is the best one. That what is the best? That is the HMG-CoA reductase inhibitors. Next, mechanism of action. So basically cholesterol is synthesized in the liver by conversion of 3-hydroxy 3-methyl glutarate coenzyme, that is HMG-CoA to malvalonic acid by the enzyme HMG-CoA reductase. So the cholesterol is synthesized in the body. So from where it is getting is by the conversion of HMG-CoA enzyme. So the HMG-CoA enzyme is converted into the malvalonic acid. So this conversion will be inhibited by the HMG-CoA reductase enzyme inhibitors. Here nothing but first the cholesterol will be synthesized by converting the HMG-CoA to malvalonic acid by using the HMG-CoA reductase enzyme. So in order to stop it, we are using the inhibitors. So in order to avoid the formation of the cholesterol in the body. So the statins will act by inhibiting the rate limiting enzyme. So thereby resulting in reduce the hepatic cholesterol synthesis. So if we inhibit this enzyme, the cholesterol formation will be inhibited in the liver. So this results in the compensatory increase in synthesis of high affinity LDL receptors on the surface of the liver cells and in uptake and catabolism of the plasma LDL and LDL. So thus the significant decrease in the plasma LDL cholesterol level is achieved. So here nothing but mechanism of action is to avoid the formation of the cholesterol in the body. How basically the cholesterol is formed in the liver. By how it will form? By conversion of the HMG-CoA to malvalonic acid by using the enzyme HMG-CoA reductase. So if we use the HMG-CoA reductase inhibitors, it will inhibit the synthesis of the cholesterol in the liver. So this is the mechanism of action. Next, let's see the SAR. The Lovastatin and Lovastatin are the lead compounds in this classification. So these two compounds are the lead compounds. So it has the lactone ring and bicyclic rings. Ethylene bridges are very important for the activity. See here, the lactone ring, bicyclic rings and ethylene bridge is important for the activity. So the Lovastatin is the open ring. See here, this is the open ring structure. It is an open ring and dihydroxy acid. See here, 2 hydroxyl groups are there. So it is the open ring dihydroxy acid with 6 hydroxyl group. Is more hydrophilic in nature. So it has a low penetration to the peripheral tissues and it has the less side effects. So next, the 3,5 dihydrocarboxylate is essential for the inhibitory activity. So this 3,5, see here, 3,5, the third position and the fifth position hydroxyl groups are there. So 3,5 dihydroxycarboxylate is essential for the inhibitory activity. And compounds containing the lactone or prodrugs which require in hydrolysis process. So the absolute stereochemistry of the 3 and 5 hydroxyl group must be same as the Lovastatin and Lovastatin. So the double bond is present between the 6th and the 7th position. It may increases or the decreases the activity. So if the double bond is present at the 6th and 7th position, it may either increases or decreases the activity, and ethyl group provides optimal activity for the compound ring containing A, and some heterocyclic rings. The ethynyl group is optimal for the compound with other rings such as indole and pyrimidine rings can be seen in the fluvastatin and servastatin. So next, the ring A subclass. So the decline ring is essential for the activity. So it is essential for the activity. The ring A subclass is the essential for the activity. So if it is replaced with the cyclohexane ring, results in decreases in the activity. The stereochemistry of the ester chain is important for the activity. The conversion of this ester to an ether. So if the ester is converted to the ether group, means decreases the activity. The methyl substitution, if it is done in the second position, means increases the activity. So the simvastatin is more potent when we compare with the lovastatin. Next, beta hydroxide group substitution at the R1 position means it will enhances the hydrolipicity and provides some cellular specificity. Next, ring the subclass either 0 or 1, 5 or 6 member heterocyclic. So it is a 5 or the 6 member heterocyclic ring. So the parafluorophenyl cannot be coplanar with the central aromatic ring. Means it loses its activity. So the R position between it is replaced with the aryl groups of the hydrocarbon chain, means it will enhances the lipophilicity and it will inhibit the activity. So this is the SAR. Next, pharmacokinetics. It is the oral route of administration and it get well absorbed. Except all the drugs will get well absorbed except fluvastatin is well completely absorbed when we compare it with other drugs, and lovastatin and simvastatin are the prodrugs which get hydrolyzed to active metabolites in the gastrointestinal tract. So it is the oral route of administration and the drugs undergoes a metabolism process in the liver, but this lovastatin and simvastatin are the prodrugs. So after the administration and when it reaches to the gastrointestinal tract, it will get activated and remaining means the drug undergoes a first pass metabolism and it is excreted through the bile. Next, adverse reactions are nausea, headache, skin rashes, bowel upset, sleep disturbances, memory loss, impotence, and liver damage, peripheral neuropathy. So these are the adverse drug reactions. Next, uses. It is used in both primary and secondary hypercholesterolemia, and they can reduce the progression of atherosclerosis and occurrence of myocardial infarction. So these are the first line drugs which are primarily used for the hyperlipidemics, which increases the LDL and total cholesterol level. So these drugs mainly used to reduce the cholesterol level in the body and also reduce the index of the myocardial infarction in the patients. In this drug is lovastatin. This is the structure, and if you see the IUPAC name 8, 2, 4 hydroxy, 6 oxo-oxane, 2YL ethyl, 3,7 dimethyl, hexahydronaphthalene, 1YL, 2-methyl butanate. See here 8, 2, 4 hydroxy, 6 oxo-oxane, 2YL ethyl, 3,7 dimethyl hexahydronaphthalene, 1YL, 2-methyl butanate. If you see here, this is the naphthalene structure. This is the naphthalene. In the third and the seventh position, methyl groups are there, 2 methyl groups, and here in the eighth position, 1, 2. 2 carbon atoms are there, that is ethyl. For this ethyl, in the second position, this oxane structure is attached. So for this oxane, In the sixth position, oxygen group, and here in the fourth position, hydroxyl group is attached. Here in the first position of the naphthalene, 1, 2, 3, 4. 4 carbon atoms are there. So it is in second position, methyl is there. So it is 2-methyl butanate. See here, 8, 2, 4 hydroxy, 6 oxo, oxane, 2yl, ethyl, 3, 7 dimethyl, naphthalene, 2-methyl butanate. So this is the structure and allopathnine. Properties are it is a white or almost white crystalline powder and it is insoluble in water and soluble in acetone, sparingly soluble in ethanol and insoluble in hexane. Next, pharmacokinetics. It is a oral route of administration. So it is a prodrug. So okay, prodrug means after the administration. So it is a prodrug. So prodrug means before administration it is the inactive form. After the administration of the drug, it is the active form. So it is the oral route of administration and it is given as the lactose prodrug in order to produce the mechanism of action. And it requires to be converted to the beta hydroxy form. So the drug activation process do not seems to related to be cytochrome enzyme activity, but rather it is controlled by the activity of serum peroxidase. So, following the oral dose of this drug, it is excreted through the urine and in fecus. So, it is an oral route of administration and it is administered as the lactose prodrug in order to produce the mechanism of action and to convert the drug into the active form. And it is eliminated through the urine and fecus. Adverse drug reactions are pain in the stomach, constipation, nausea, headache, memory loss, heat burn, weakness, loss of energy, muscle pain, confusion, inability to fall asleep. Next, therapeutic uses, it is used to reduce the amount of cholesterol and other fatty substances which is present in the blood. And if the cholesterol develops in the arteries, so if the cholesterol is there, means it will block the flow of blood to the heart, brain and various parts of the body. So in order, it will causes the heart attack, stroke. So in order to avoid this drug is used to remove the cholesterol from the body. Next is fabric acid derivatives. So it is the groups of the drugs or the derivatives of fabric acid like isobutyric acid and includes the benzofibrate and gemfibrozil and fenofibrate. So these are the drugs that is gemfibrozil, benzofibrate and fenofibrate. The mechanism of action is these are known to stimulate the nuclear transcription receptors called peroxisome proliferator activated receptor. So that is the peroxisome proliferator activated receptor. So it will control the expression of the gene mediating triglyceride metabolite. So it will control. So this is the receptor this is the receptor. It will control the triglyceride metabolism rate. So they enhance the activity of the lipoprotein lipase and which is responsible for the hydrolysis of very low density triglycerides and hence the incorporation of the fatty acid into the very low density lipoprotein in the liver is decreased and thereby synthesis and secretion of the very low density lipoprotein is inhibited. Its main mechanism is nothing but to avoid the synthesis and the secretion of the very low density lipoprotein. So because very low density lipoprotein is very dangerous cholesterol, it will causes several heart problems. So to avoid this have to be inhibited. So it can be inhibited by using the fabric acid derivatives. Next, SAR. So isobutyric acid is essential for the activity. See here, isobutyric acid is essential, and the compound containing esters such as clofibrate and phenofibrate are the prodrugs and required in hydrolysis process. So if the substitution is done at the para position of the aromatic group with chloro group or chlorine containing isopropyl ring produces the compound with significant longer half-life. So it will increases the half-life when the structure containing the chloro group or chlorine containing isopropyl at the para position. So most of the drugs containing the phenoxy isobutyric acid, the addition of the propyl spacer seen in gem fibrosine result in active drug. So this is the SAR. Next, pharmacokinetics. It is completely absorbed in the gastrointestinal tract, and it also having the good protein bonding capacity, and it is excreted in the urine in unchanged form. Adverse drug reactions are allergic reactions, nausea, diarrhea, gaining of the weight, and increase in serum aminotransferase or alkaline phosphatase level, and reversible myopathy has also reported. And also the formation of the gallstone. So gallstone formation can also be seen. Next, uses. These are the first line drugs used in the treatment of the hypertriglyceremic, especially those associated with low HDL-C level. So it is mainly used to reduce the bad cholesterol in the body, and they are effective in decreasing the genetic hypertriglyceridemic and desbetalipoproteinemia, and also it is effective in treating the hyperlipidemics associated with type 2 diabetes. So here nothing but it is used to reduce the bad cholesterol in the body. Next in this drug is clofibrate. This is the structure of the clofibrate, and this is the isopattern, that is ethyl 2,4-chlorophenoxy 2-methylpropionate. See here, ethyl 2,4-chlorophenoxy 2-methylpropionate. If you see here structure here, this is the phenyl. For the phenyl, in the fourth position, chlorine atom is there. Here 1, 2, 3. 3 carbon atoms means propane. So it is propionate, and again here ethyl is there. See here, this is 2 carbon atoms. 2 carbon atoms means ethyl, and here this is the methylpropionate. In the second position, methyl group is there for the propionate. Here in the second position, 2,4-chlorophenoxy. So this is the structure and isopattern. Properties: it is a colorless to pale yellow liquid, and it is characteristic odor and characteristic taste, and it is insoluble in water and soluble in alcohol and chloroform, and it is miscible with acetone and ether. So pharmacokinetics, it is oral route of administration. It undergoes the metabolism in the liver through first pass metabolism. So it undergoes a first pass metabolism to produce the active form of the drug, and it is eliminated through the urine. So oral route of administration, it is a hepatic and gastrointestinal. Rapid de-esterification occurs in the gastrointestinal tract or on first pass metabolism to produce the active form, that is chlorophenoxy isobutyroic acid. If you produce the chlorophenoxy isobutyroic acid, it is eliminated through the urine. Next, adverse drug reactions are headache, nausea, vomiting, fever, blood in urine, sweating of the feet, increase of appetite means increase of the hungry, stomach pain, gastric problems, weight gain, and chest pain. Uses, it is used in the treatment of 2, 4, 5 hyperlipidemias, and is also used in the effective treatment of the familial combined hypertriglyceridemia and hyperlipidemic associated with the type 2 diabetics. Next, bile acid derivatives. So here these are the insoluble and non-absorbable basic anion exchange resins. So it will bind with the bile acids and form insoluble complexes in the intestine which get excreted in the fecus. So here what we'll do is it does not allow us to digest in the intestine and it get excreted in the fecus. And adverse drug reactions are headache, vomiting, constipation, heartburn are common. Next, uses, it is used as an anti-hyperlipidemic in children and pregnant women, and also it is used for treating the jaundice and also biliary cirrhosis. I will explain the mechanism of action. These are the insoluble and non-absorbable basic anion exchange resins, so which bind with the bile acid. So this drug, it will bind with the bile acid and form the insoluble complexes in the intestine. So this drug mainly bond with the bile acids and form the insoluble complexes in the intestine and get excreted in the fecus without getting dissolving in the body. Next, SAR. The cholestyramine is the copolar consisting primarily of the polystyrene with small amount of the divinyl benzene as cross-linking agent. In addition, it contains some fixed quaternary ammonium group. So this positively charged groups functioning as binding site for anions. And Colestipol is the copolar of tetraethyl ethylene pentamine. So it is a tetraethyl pentamine. It consists basic, secondary and tertiary amines. So total nitrogen content of the Colestipol is greater than the cholestyramine. So the number of nitrogen content is more in Colestipol than the cholestyramine. The functional ion exchange capacity is resin, depends upon the intestinal pH, may be less than cholestyramine. Means the number of the nitrogen is more in Colestipol when we compare with the cholestyramine, but the ion exchange capacity is less. Ion exchange capacity and intestinal pH is less for the Colestipol when we compare with the cholestyramine. The absorption capacity of the cholestyramine for the bile acid is more. So absorption capacity is more for the cholestyramine when we compare with the Colestipol. So first drug is cholestyramine. This is the structure. And IUPAC name is 4,3,4-ethyl phenyl butyl phenyl and trimethyl azanium. See here 4,3,4-ethyl phenyl butyl phenyl trimethyl azanium. If you see the structure here, this is a phenyl. For the phenyl, here in the first position 1, 2, 3. 3 methyl groups are there. So that is trimethyl. Nitrogen is azanium. So trimethyl azanium. For the fourth position of the phenyl, here 1, 2, 3, 4. 4 carbon atoms means butyl is attached. And here in the third position, the phenyl group is attached. For the phenyl in the fourth position, ethyl group is there. See here 4, 3, 4 ethyl phenyl. This is the butyl phenyl trimethyl azanium. And the properties are, it is a white or almost white powder. It is hygroscopic, means if you expose this drug to the moisture means it to the atmosphere means it will absorb the moisture from the atmosphere insoluble in water. methylene chloride, and ethanol. Next, pharmacokinetics, it is oral route of administration and it is metabolized through the bile acid. And this cholestyramine resin absorbs and combines with the bile acid in the intestine to form non-soluble complex which is excreted in feces. Adverse drug reactions are constipation, stomach upset or stomach pain, diarrhea, nausea, vomiting, belching, and loss of appetite, skin rashes. Uses, it is used to reduce the high cholesterol level. So the main use is to reduce the cholesterol levels in the body. So it is given to the people with high cholesterol who does not able to lower their cholesterol enough with the diet change. Means this drug is given to the person those who cannot able to change themselves, even they are following the good diet also. So for that person, we have to give this drug. Next, Colestipol. So this is the structure. An IUPAC name is N2,2,2 amino ethyl amino ethyl ethane 1,2 diamine hydrochloride. See here N2,2 amino ethyl amino ethyl ethane 1,2 diamine hydrochloride. See, we see the structure here. 1, 2. So this is the amine group. The first, this is the ethane amino, and this is the ethyl amino, and ethyl amino is there. See here, 2, 2. In second position, 2. In second position, amino. This is ethyl amino, and here ethyl amino, ethane. For the ethane in first position and the second position, diamines are there. So it is the next hydrochloride. See, 2, 2, and 2. 1, 2. In second position, amino group is there, and here this is the ethyl amino, and here ethyl amino. Here ethane group is there. For this ethane, here for in the first position and in the second position, amine groups are there. Diamine hydrochloride. So properties, it is orange to yellow color, hygroscopic in nature. It does not dissolve in the water and dilute aqueous solution of the acid and alkali. And it is insoluble in ethanol and dichloromethane. So pharmacokinetics, it is an oral route of administration and it will bind to the bile acid in the intestine, forming a complex that is excreted in the urine, feces. So in the human, less than 0.17% of the single dose is excreted in urine when following 60 days of chronic dosing of 20 grams of Colestipol hydrochloric acid per day. So if we take the 20 grams of the Colestipol drug, so it is excreted that less than 0.70% within the percentage, and it increases the feces loss of bile acid due to the Colestipol hydrochloride administration leads to increase the oxidation of cholesterol to bile acid. So it is not absorbed in the systemic circulation, nor it is hydrolyzed by the digestive enzyme. Its action is ultimately limited to the lumen of gastrointestinal tract, which is eventually passed into the feces. Means it is an oral route of administration and it combines with the bile and which forms the complex in the body. So it does not enter into the systemic circulation. So without entering into the systemic circulation, it forms as the insoluble complex and directly it will eliminate it through the fecus. Next, adverse drug reactions are constipation, diarrhea, stomach pain or abdominal pain, gas, problem, nausea, vomiting, weakness, confusion, skin rashes, and it is used to reduce the cholesterol level in the body in order to reduce the strokes and heart attacks. This drug is also can able to give with proper diet in order to reduce the cholesterol level in the body. So these are the references books to be followed for the anti-hyperlipidemic agent. Thank you.